Jodie, a diabetes nurse from South Africa. If you're viewing this video, the title must have caught your eye. You've been diagnosed with diabetes and have heard about the risks of you developing heart disease. Some people are so overwhelmed when they're told about their diabetes, all the advice and instructions around how to manage it, and they don't fully understand some of the terms. So today I'm going to explain a little about something known as macrovascular disease, what the risk factors are, and what you should be doing to help yourself. But before we begin, we probably need to briefly talk about the complications of having diabetes. You've heard that people with diabetes may have problems with their eyesight, or they have their kidneys are no longer functioning so well, or they may have pricking and burning in their feet. These symptoms are as a result of the damage to the small blood vessels and are known as microvascular disease. In fact, up to 30% of people with type 2 diabetes already have complications of diabetes at the time of diagnosis, which is quite frightening. So what is this thing called macrovascular disease? Well, macro refers to something large. Therefore, macrovascular refers to large blood vessels. So macrovascular disease is a disease of large blood vessels in the body, such as those supplying your heart muscle, the brain tissue, as well as the blood vessels that run down your legs. People with macrovascular disease are people who have heart failure, heart attacks, strokes, or poor circulation to the feet, possibly resulting in foot ulcers or even gangrene. Macrovascular disease is the commonest cause of both ill health and death in people living with type 2 diabetes, so it's a little bit grim. The American Heart Association have reported that there is a strong correlation between heart disease and diabetes. In fact, around 68% of all adults over the age of 65 will die from some form of heart disease, and 16 of those to strokes. And adults with diabetes are 2 to 4 times more likely to die from heart disease than adults without diabetes. But it's not actually all doom and gloom. Diabetes is completely manageable. It's just that sometimes people don't understand the risk factors and what you should be doing to assist yourselves. So why are people at increased risk of heart disease? Even when glucose levels are under control, it greatly increases the risk of heart disease and stroke. That's because people with diabetes, particularly type 2 diabetes, may have other conditions that might add to their risks of developing heart disease. Before we look at the risks, we need to take a step back and talk about something known as insulin resistance. Insulin resistance is a condition that really messes up the normal functioning of the body's metabolism, and that's meaning the metabolism of not only your starches or your carbohydrates, but that of fat and protein as well. And insulin resistance means exactly that. Your body is becoming resistant to your own insulin, and as a result, the glucose in your bloodstream can't enter the cells of the body. We think of insulin like a key of a door. When the key is broken, the key can no longer open the door. So the body, in the form of a pancreas, tries to produce more keys. Eventually, the body, or more specifically the pancreas, becomes incapable of producing strong enough insulin and eventually may even cease production. These are just some of the symptoms of insulin resistance that you might be experiencing. Now let's take a look at some of those risk factors for heart disease and things that you can do something about. So you might well go to a doctor and he does a number of tests, and one of them being to test your blood pressure. So one of the risk factors for heart disease is high blood pressure or hypertension. High blood pressure has long been recognized as a major risk factor for heart disease. There is a close association between having high blood pressure and insulin resistance. When patients have both high blood pressure and diabetes, which is a common combination, this risk for cardiovascular disease doubles. One of the other tests that you might undergo is to test for cholesterol. Some people just go to a local clinic and have a finger prick test and find out, oh, my total cholesterol level is quite low. But what they're not taking into consideration is what makes up that total level. It's very important. We need a healthy balance between the good fats and bad fats. You may have heard of LDL cholesterol. These are the bad fats. You don't want too much of that. The good fats, known as the HDLs, are often reduced in people with diabetes, and this means that your cardioprotective fat is less. People with diabetes often have a high HDL, high LDL, low HDL, and high levels of fatty acids or triglycerides. And having this triangle is an early indicator of heart disease. It is also associated with insulin resistance and the formation of fat deposits in your blood vessel walls, called athero or arteriosclerosis. You just need to look around you lately to realize what a fat nation we're all becoming. In fact, here in South Africa, we are number 5 on the list of fattest countries worldwide, and top of the list for Africa. Scary. So obesity is a major risk factor for cardiovascular disease and has been strongly associated with insulin resistance. Having an increased girth, or otherwise known as a waist circumference, is a good indicator of insulin resistance. Weight loss can improve your cardiovascular disease risk, can decrease your insulin concentrations, and increase your body's sensitivity to insulin. Obesity and insulin resistance have also been associated with other factors, including high blood pressure. What about the lack of physical activity? Well, we know that another modifiable risk factor is being physically inactive, meaning you can do something about it, and exercising and losing weight can prevent or delay the onset of type 2 diabetes. It can reduce blood pressure, and it can help reduce the risk of heart attacks. Any form of activity will do, whether you like to go to the gym, or you do housework, or gardening, or work-related physical activity. They're all similarly beneficial. Naturally, because you are diabetic, you need to manage your blood sugar. Too high sugars or consistently going out of range can actually put a significant risk onto your blood vessels. Persistent high blood sugar causes changes to the lining of the blood vessels. It exacerbates inflammation and makes the vessels start to harden and narrow. You may need medication to manage your blood sugar. And no great surprise with smoking. Smoking puts individuals, whether they have diabetes or not, at higher risk for heart disease and strokes. The longer you have diabetes, the higher your risk of heart disease. So, looking at these risk factors, you've noticed that you have control over all of them. All right, I can't make you younger, but you can manage most of them to reduce your risk of heart attack. How do we do that? We need to make sure that we're eating correctly, eating balanced meals that I mentioned earlier. We need to watch your weight or get to lose weight. Get physical, but if you're going to start exercise and you haven't exercised before, please do speak with your doctor first. Take medicines as prescribed. Don't take them when you think you need to take them. You take them as directed. Quit that smoking and test your blood sugar. If you take these risk factors into consideration and try and modify them, you will be able to manage your risks of developing heart disease and stroke for later on. I wish you luck in managing your diabetes. Remember, you manage it. It doesn't manage you.